In case there are any other stragglers. I'm David Mackey. I'm with the Lions Eye Institute at the University of Western Australia. I was the Managing Director of Lions Eye Institute and stepped down nearly 3 years ago to go back into full-time research. And myopia, or short-sightedness, is one of the things that we're very interested in researching. So, audience participation. Who here is short-sighted or myopic? Okay, so that's 1, 2, 3 out of... You're not. So, a minority. Well, that actually is the situation in Australia, but if you're in other parts of the world, a lot more hands would be going up. So what is myopia or short-sightedness? We can show this with politicians, although most people, when they call them myopic, are usually referring to their policies rather than what they wear on their heads. But it's where you need to wear glasses to see in the distance clearly. So sometimes we need to wear glasses to see up close, and that's what happens to people when they get over 40 years of age and your zoom focus gets longer and longer and your arms aren't quite long enough, they seem to get shorter, and you need to wear some plus lenses, and these are the ones you can get from the chemist shop, although ideally you want to make up for what's the focus power of your eye plus the near distance that you're working at. But myopia is when you need them to see far in the distance, and this is usually something that comes on in adolescence or early adult life. And if we look at a distribution curve, now this is from the RAIN study here in Western Australia. Who knows about the RAIN study here? Okay, yep. So this was a study, Fiona Stanley, who's a professor of paediatrics at the time, and John Newman, who was professor of obstetrics, set up a study where they were looking at a whole lot of women who were pregnant and looking at their babies and seeing what factors during the pregnancy influenced the outcome in the babies. And very fortunately, the RAIN Foundation, which is where the name comes from the estate of Mary Rain, funded this study in Perth to continue, and these babies are now in their 30s. And I had the privilege of examining 1,345 of them when they were aged 20, and we saw another 800 odd of them when they were 28. And so we collected some very valuable eye data there, because this age group is one of the groups that we don't know much about. So when we looked at how much short-sighted or long-sighted they had, so 0, so if you don't need any glasses at all to focus in the distance, is just here, right in the middle. And this is on the slightly plus side, and this is on the slightly minus side. And then it's these people here who are the ones wearing glasses. And you can see here, you're getting up to numbers like -10. So I'm only wearing a -2 lens, so I'm up here. But there are some people who are very short-sighted, and you'll notice they have glasses that look like Coke bottles. So here in Western Australia, the vast majority of people in young adult life are right here in the middle. And in fact, we probably have some of the lowest rates of short-sightedness anywhere in the world for young adults. It's only around 25%. Depends what cutoff you use to give that percentage, but these are some of the lowest rates here. Does anyone know places in the world where it's becoming an epidemic? Or it has become epidemic?
China.
Absolutely. The data there is quite interesting. So this again is showing you, and I'll come back to China on a couple of points, this is showing you what's happening with the eye. So you've got focusing coming from the cornea at the very front, then the lens that's in the centre of the eye, to have the light focused on the back of the eye. Now, I used to be able to talk to people about how cameras work. Now with iPhones, no kid has a clue about the lens and the focal lengths of cameras, so my analogies aren't as good. But the camera is too long, the axial length is too long for the focusing power of the eye. And this is mainly from the eye growing too much. And we're now learning a lot about what's the mechanism that leads to this. And if you put glasses in the front, that refocuses the light and then brings it into focus. And you can wear glasses on the top of your nose, you can wear glasses on the front of your eyeball, that's what a contact lens is, or you can actually carve a contact lens into the cornea at the front of your eye, which is the main type of refractive surgery. Now, this is the worrying prediction. This was from the World Health Organisation. Professor Brian Holden, the late Professor Holden at University of New South Wales, actually published this paper on which the data is based. But you can see here back in 2000, it was estimated there a quarter of the world's population were myopic. But when we get to 2050, a number that we're hearing in the media a bit at the moment with climate change, but by then we'll be looking at over half of the world's population being myopic. And in fact, I used to worry that this was maybe an overestimate, but it may in fact now turn out to be an underestimate when we get the data. Now, the boom in myopia really has been noted in China because it's such a big country. So the cities of Beijing, Shanghai, Guangzhou all have numbers of school kids leaving or people entering university in the order of 80 to 90% of kids are wearing glasses, compared to our 25% here in Western Australia. Now, although everyone's talking about it in China, it was noticed before that in Hong Kong, Taiwan, Singapore and South Korea. And it was really extrapolating children's vision assessment data. This graph was created for this Golden paper. That back in the 1950s and 60s, it was similar to our Australian data. And then, really in the 1970s, it took off in these East Asian cities, and it really peaked by 1990. And the China phenomenon is lagging behind this, and there are a few reasons for that. So as I mentioned, the RAIN study here in Western Australia, we did this fabulous project funded by the National Health and Medical Research Council, where we examined them. Using this cutoff here, we get 23%. Using a slightly more conservative one, we're up to 25%. Now, is this staying the same in Australia, or has it gone up? What about people my age compared with my parents' age? So, RAIN children a fair bit younger than me. And there have been several studies done in Australia. The Blue Mountains Eye Study, or Blue BMES, was done back in the early 1990s, and most of the people in that study were born before World War II. Then we have the Melbourne Visual Impairment Project, which was a similar big study done in Melbourne, and they also looked at some rural centres around Melbourne, and they found these rates. So Blue Mountains a bit higher, 24%, Melbourne a bit lower, around 16% of myopia. And we compared this with one generation younger, so these were mainly baby boomers, and we had two sources here in Western Australia. The parents of the RAIN study came in and we examined what power lenses they needed to wear, and that was fairly high. That was about 30%, which is one of the highest of any populations measured in Australia to date. And then another really important study in Western Australia is the Bustleton Study, and the group in that, the Bustleton Healthy Ageing Study, are a group of people, about 5,000, who've been seen since about 2010. They were enrolled when they were aged between 46 and 64 years of age. And that's a lower rate than the city-dwelling Perth people. And this is a general finding that the people who live in the country have a bit more short-sightedness than the people who live in the cities. Now, why worry about this? Just, do we give everyone a pair of glasses and everyone will be happy? Is if you get into the really high levels of myopia, your eye stretches out so much, you start damaging the back of the eye. Now, this can tear and you get a retinal detachment, which is what we see here, or you can get tearing around the macula and you get a type of macular degeneration, or you can tear around the optic nerve and get glaucoma. So several of the major causes of blindness are exacerbated by high levels of myopia. Now, we set up a study a few years ago called the Consortium for Refractive Error and Myopia, and the main object of this study was actually to find if there are genetic contributing factors to it. So although we know it's something that's gone up a lot, there must be some environmental and behavioural changes that would be triggering that. But what are the genes involved and how do these interact, and what can we look at for interventions into the future? And this was a paper just published a bit over a year ago, and we've found nearly 500 genes contribute to it. And the analogy I gave to a whole lot of eye researchers, it's a bit like thinking of genetics. If someone gives you a $5 note, you're going to get the disease. But if I give you a small bag full of coins, I can also give you $5. And this is how a lot of complex genetic diseases work out. It's all these little coins that are adding together to give people a risk for myopia. And some of these are going to be the ones that interact with the environmental studies. So these were the main groups that contributed to this study. We had the UK Biobank, which is an incredible study of 500,000 people, where we had genetic and spectacle data on 100,000. We had the consortium that I've mentioned. In America, there's a direct-to-consumer company, 23andMe. Then we had another one from the health maintenance organisation, Kaiser Permanente. So a lot of studies coming together, giving us 500,000 people's genetic and spectacle wearing data. And that's what we've needed for doing these levels of study. And we thought, oh, this is going to help us understand where is the actual gene working that leads to short-sightedness. And if we look at the retina, the back of the eye, the film in the camera, lots of different cells, and there are lots of different genes involved in different cells. And in our myopia study, it looks like all of the cells are contributing to the risk of short-sightedness, as well as the ones that are shown on the left, involved in the development of the cornea and the lens and the sclera of the eye are involved. So the understanding this has given us is that it's actually the entire orchestra that you've got to put together and have operating properly. And if there's any piece that's not working, that messes up the symphony that we're meant to create of having a harmonised eye. So that's the genetics, that's my main area of research. But we also look at the environment. And the first person to ever come up with here's what I think caused me to be short-sighted, was the astronomer Kepler, and he blamed his own short-sightedness on all his study. So since the early 1600s, we've been repeating this and putting more evidence into this. And we, more recently, everyone says, I know what's causing children to be short-sighted. It's this, the mobile devices. Now, these only came about in the early 2000s. But the short-sightedness epidemic we saw in Hong Kong, Singapore, happened back in the 70s and 80s. We didn't have mobile devices. We didn't even have laptop computers back then. So it was actually the near work that people do nowadays off a phone being done from books that we think was the difference in contribution. So although everyone wants to blame the devices, we don't think that that is the absolute result. And the Singaporeans, who have 90% myopia in their young adult populations, looking at all the studies and all the literature, just can't find any solid proof that mobile devices themselves are the problem. The interacting factor about using a mobile device is what we're all doing now. Now, if you want to look at your phone or read your book, most libraries, although they're well illuminated, are inside. We are not outside in the brightest sunlight. And the interaction of these factors is very hard to disentangle. So the amount of time you spend in the education system, the amount of time you spend reading and doing near work, and the amount of time, or lack thereof, spent outdoors are all heavily intertwined. And in doing any study, we have a lot of trouble disentangling these parts of the knot to work out what it is. And it's a bit more like a Gordian knot. And hopefully, using genetics and our environmental studies of interaction, we can untangle this a bit more simply than Alexander the Great would have. So the data with education is pretty compelling. If you only finish primary school, you're unlikely to be myopic, but if you go on to tertiary education, or particularly if you do a higher degree, then you are more likely to end up being short-sighted. But when we look at this, there's more to education than just attending the university. It's what sort of intensity of near work are you doing, what are your behavioural changes, and now we've seen a move from blackboards to whiteboards to screen. With all of these people doing home learning through the lockdown, that's going to possibly have impacts, and we don't yet know what it will be like for this. If we look at countries that score well on the PISA scoring system, so this is an international OECD assessment of kids' performance. They pick some schools from each of the countries and then compare them. And you can see here the countries that are coming out in the very top, such as China, Singapore, Macau, Hong Kong, Taiwan, Japan, Korea, are all countries with really high rates of myopia. Estonia is the odd one out, but other countries in Northern Europe also are turning out to have an epidemic of myopia that's kicked off there. So the factors that the Hong Kong people are pulling out is one thing kids who do really well academically have that's different is that they spend an extra 2 hours a day of supervised tutorial type time, or cram school as it is called. And this, we suspect, is a major contribution, and a lot of kids in Australia, particularly Asian kids, still do this here, but not as much as their compatriots in Hong Kong and Singapore. So what about outdoor time? This was an area that we were heavily involved with in Australia. The group in Sydney with the Sydney Myopia study led by Kathy Rose was the first to really have solid data that the kids who didn't spend much time outside were more likely to become short-sighted. And in fact, we've been looking at this area in Western Australia. Now, if you look at the amount of light that hits the Earth, it's really correlating with the good and the bad. So here we are in Western Australia. You can see all of this sunlight that falls here. But if you look at China, all this blue here probably isn't related to the actually the latitude they're at. It's probably relating to the pollution that's available in China. So that's contributing to that. And then you can see the other bluish area is the north of Europe, particularly the British Isles, where they're noticing the epidemic as well. So in Australia, yes, we've got lots of sun, but our problem has been skin cancer. And what we have been doing is telling everyone, you need to spend more time in the shade, wear a hat, sunglasses, protect yourself, don't go out in the middle of the day. And we think that this is the balance of the difference between why we've got low rates of short-sightedness here and why we've got high rates of skin cancer. And in fact, using the Bustleton study, we actually proved that this is the case. We looked at people who had had skin cancer reported, and we then measured their eyes, and those individuals, only 11.5% of them were short-sighted, but the people who didn't have skin cancer, there was nearly 22% of them having skin cancer. So here's the take-home message. If you spend more time outside, you'll be less likely to be short-sighted, but more likely to get skin cancer. And getting this balance right is going to be one of the important things we need to work on. So in China and in Taiwan, they have done studies to show that if you force the kids to spend a specific period of time outdoors, you end up with less myopia developing in these children. So solid evidence that this is related. What actually is it about being outside? We're still not 100% certain. We earlier thought it was just looking far in the distance, then we thought it might be UV light, and could that be related through vitamin D? But most of these studies haven't supported that as the mechanism, and we suspect that it might just be the brightness. Now, in here, we're probably several thousand times less bright than we would be if we were standing out in Hay Street. So if we're going to ramp up the brightness, it would be actually very energy consuming and probably make it a bit harder to read. So one of the things we developed was a way of looking at how much sun damage was on the eyeball itself. And these measurements here are taken with ultraviolet light, and you can see the area that glows up. And people who have sun damage, this is where you get this growth called a pterygium. And what we found here, there's a really good correlation of the amount of this sun damage with the amount of time people spend outdoors in summer and in winter. And this was again done on the rain study here in Western Australia. And then when we used this marker to look at myopia, you could see that the individuals in blue who were myopic were most likely to have the least amount of this sun damage marker, whereas the ones on the right who didn't need to wear glasses were more likely to have the most sun damage. And we've repeated this in twin studies on the east coast of Australia, in Norfolk Island, and we're now in the middle of analysing this for the older individuals in the Bustleton study. Now, a beautiful study that we had found existed here in Western Australia was a skin cancer study done back in the early 1990s called the Kids Skin Study. And there'd been 1,700 children participate in this, and they were observed through primary school. So a lot of data had been collected, and they'd been recontacted when they were about 15, and we went back and asked if they'd come back in their late 20s. So between the ages of 25 and 30, we saw 300 of these individuals, and we were able to actually validate the amount of time that they'd spent outdoors that was measured correlated with this amount of sun damage on the eye, and it also correlated with the lack of myopia. The other marker that we looked at was vitamin D, which in the younger children, on the Yazar paper graph over there, you can see the lower levels on the left and the higher levels on the right. And it was even more noticeable in the 10% of children in Western Australia who are of Asian ancestry but born here. But when we looked at the Bustleton study, the amount of vitamin D says how much sun you've had over the last couple of months, and there was no correlation at all. So it might be that all of the highly studious business people, after making all their money but still being short-sighted, are down there on their boats and outdoors getting lots of vitamin D, but it's not going to change your level of myopia at that age. So when we look at these environmental factors, when we look at these genetic factors, there is definitely an interaction here. This is data from the Netherlands. So we're now trying to put together this data for all our studies here in Western Australia. And our question is, what's going to be the right amount of sunshine that we need? And what we find for lighter coloured people and skin, we don't want to send them outside too much. People with darker skin can spend more time outdoors. So how can we get this balance right? I'm going to come back to China. And the big question is, why was China behind Hong Kong and Japan and Singapore? And it actually, one of the hypotheses was that it was actually the Cultural Revolution in China, where the government shut down education and sent people to work in the fields. And this is actually one of our research assistants in Melbourne, or postdocs there, Helena. And she was actually a child growing up in China, and they used her photograph in one of the publicity shots back there. And one of the very clever researchers, Joost Jonas, when I asked him about this as an idea, he said, oh yes, we did analyse that a few years ago. And you can see here that the individuals who were born in different eras, the rate of myopia was going up and then it dropped back down because of the Cultural Revolution. And it was the fact that the Chinese economy opened up in the 1980s and then kids were encouraged to study and do education that we've seen this huge spike back up again. So COVID, what's this going to do? So we wrote a piece back in early 2020 and said if kids are going to be inside on computers and on personal electronic devices and not playing outside, we predict this is going to have an impact on short-sightedness. The group from Singapore equally were concerned about this and wrote another article. The city in the world where I think we're going to look at this question the most will be Melbourne. We have tried to start up a study with them for the last year, but they keep going back into lockdown. Hopefully now we will be able to start the idea of looking at children to see what's happened there. If you want to look at the impact of children, this is from UNESCO looking at children's educational disruption. And this was the amount of lockdown. So February, March, April, May. So by April, they said 1.5 billion children had had their education disrupted. So a lot of these kids were forced to spend time at home. For some, it was a couple of months. For kids in Melbourne, it was 200 days. So a huge impact around the world. And the worry is this going to increase short-sightedness? Now, unfortunately in Australia, we did not have any big studies of short-sightedness because everyone said, it's not a problem here. Whereas in China, they were very concerned about this, and quite a few cities were running big studies looking at school kids in every age group every year. And you can see here all of these curves. So when we look at the young kids here aged 6, you remember that curve I showed you of the rain study where it was this very leptokurtotic, where a very steep pyramid, a bit like the version leafer. Whereas as the kids get older, you can see the number of people moving to this short-sighted level, and this distribution curve's collapsed. It looks more like the Sphinx now. And that's this huge growth in the number of individuals. So that's the zero line here. So that's only about 10% of the population aren't short-sightedness. So lovely data they've got there. But what was most exciting is they looked at these kids in July 2020. So these kids had come out of lockdown, and what did they notice there? So they looked at the percentages of myopia for the 13-year-olds, 12, 11, 10, 9. So not much difference here in the 2020 year. But then when you start looking at the 7 and the 6-year-olds, a huge difference there. So it's gone from about 5% of 6-year-olds in 2019 to 20% in 2020. So this study was the first and probably the most thorough one that was published. There have been another 3 studies out of China, one out of Hong Kong and one out of Spain. So it looks like we have a ticking time bomb of what's happening with younger children around the world because of this. Now, another thing that's changed was kids aren't taking gap years. So a lot of kids get to 17, finish high school, going backpacking around the world or working or doing something. And because of the travel bans, children aren't travelling. And we went back and said, well, we've got all this data from the RAIN study looking at young adults, and we know who in those groups took a gap year and who didn't. And we said, was there any evidence that the kids now aged 30 who took gap years a decade ago, were they more or less short-sighted? And the answer is, it doesn't seem that taking a gap year makes any difference. So I don't think we're going to have to worry about this end of the school-age population, but I think the young primary school kids are going to be the ones we need to worry about. Now, the simple thing was to say, just send all the kids outdoors and get them to have as much sunshine as they can. Then I'm going to be cursed in 40 years' time of creating this huge epidemic of skin cancer. So research needs to be done to work out what is going to be the best approach. But we've now got these kids who have had time in lockdown who are going to become myopic. How can we slow this down? So looking at giving them reading glasses or other things, or forcing them not to wear glasses, doesn't seem to make a difference. You can get them to wear very hard moulded contact lenses called orthokeratology. Half of the kids can't tolerate this at all. And then the other things you can look at are low-dose atropine drops. So these are similar to the drops that people have when you get an eye check and they dilate your pupils to have a look at the back of your eye. And it blurs everyone for up near, particularly if you're a kid. And it was found that using this at a low dose was beneficial. So atropine comes from the belladonna plant. We've got new derivatives of this drug, but it's actually the original one that's been in use for hundreds of years. And this is probably the most elegant study. I must credit the Singaporeans did all the hard initial work, and then Hong Kong designed a really good study that showed that if you were put on the drops at a higher concentration for some kids, you slowed the growth of the eye, you slowed the increase in myopia. So this is now being used in Australia. It hasn't been officially approved, although we're allowed to give 1% atropine, but to dilute it 100 times as a low concentration isn't technically approved. But a lot of doctors get pharmacies to dilute it for them. But we're running a study here in Western Australia, our Atropine for Myopia study, where we've enrolled about 150 kids, and they have been followed now for 2 years. We'll be doing our analysis after the last examination in December this year, and we'll be able to have a look at the effect of this. Now, another thing that one of my research team pointed out is, David, this is the only study in Australia where a whole lot of children have been examined every few months before and after the COVID pandemic. So I'm there going, yeah, but we've got 150 kids and half of them have been on treatment, but then a percentage of them haven't been. And the Chinese study had 100,000 kids. However, from this data, it's looking like the lockdowns even had an impact here in Western Australia. So that's new data that we haven't yet fully analysed or published, but it is enough for us to say we're going to need to have a big look at school kids for the whole of Australia, not just for Melbourne. So the work we're doing, trying to untangle this knot, the genes are a bit like all the threads in the piece of rope, and hopefully they will give us new ideas of how we can interact with different molecular pathways, come up with drugs we already use, or that we can actually say this young child who hasn't yet developed myopia is at very high risk and we need to target them for various programs to make sure they have enough time outside and break up their reading time. I need to acknowledge a huge number of people who've been involved in all of these studies. A lot of work was done here in Western Australia before I arrived 13 years ago, but particularly my PhD students have all graduated and now postdocs, Gareth, Seyhan, Maria and Alex, and all the participants in these great studies. So thank you very much for listening. I'm happy to answer questions or go back to any slides. Numbed. Okay. Yep.
What about the sunglasses for children come into this?
So that's one of the things that we don't actually know. So the recommendation in the slip, slop, seek, slide sun protection was to wear sunglasses. Now the thing with the sunglasses, you can block out UV light and let most of the other light through, which is what a lot of standard spectacles do. But if you make them really dark, the worry is you may be losing the benefit from the outdoor activity. Now, if you've watched any kid with sunglasses, most of them come off pretty quickly. So I don't think we're going to see kids who've, worn around like they're in a blackened room all the time from that. But it is something where, for children who are short-sighted, we recommend get UV blocking sunglasses, but don't get particularly dark ones.
Another question. Are children in Western Australia, are they screened on any for their eyes at all? On any
So there's a big national debate and policy document coming out from the Vision 2020 organisation and looking with the College of Ophthalmologists, the College of Optometrists and the school and maternal nurse screening programs. It varies in every state. The ideal aim is to usually get kids at about 5 years of age. So what we were looking for in those early days, so there are a few really bad severe diseases that we need to pick up at birth. There are a few that can develop a few months after birth. So for instance, there's a tumour called retinoblastoma where children can get a white pupil. Running a screening program for that has proved almost impossible to sort out, and it's mainly educating people. If they notice a white pupil in a baby, they need to double check and then get the baby checked promptly. But that's only about 1 in 15,000 babies, so only see 1 or 2 a year here for that. The next group are children who are long-sighted, so the opposite of what I've been talking about, who, as they get a bit older, might go cross-eyed, and that's a way of compensating for it. So children with a turned eye who are out of focus, and if you've got your eyes not aligned, your brain says, well, you're giving me this image here and this image here, and I can't make up my mind. I like my right eye better than the left, I'll ignore my left. And then you get the child's brain developing, well, I'm doing everything with my right eye, nothing with my left eye, and the vision actually drops. So it's a bit like if you did something with your right hand continuously, had your left hand behind your back as a baby, you'd be pretty useless with that arm by the time you're a teenager. So we screen kids usually 4 or 5 years of age to check, is their vision okay, and do their eyes look straight? If they're not, we then refer them through to the eye system. Our problem is we've got limited number of children's eye doctors. The Children's Hospital here has a horrific waiting time to get into the clinic there. There are quite a few optometrists who can see kids, but it's not a favourite thing to do because there are a lot more work to examine them. So yes, we do have a program. It's probably a little bit suboptimal, and hopefully national guidelines will improve it. However, all of this has come along. We don't yet have data to say, oh my gosh, we're going to have to screen every kid to see if they've got early short-sightedness and then intervene in a treatment. That's the job we've got for the next year or two, to sort out what is happening and how do we intervene.
Yeah, just as a comment, I would take teaching for decades, and that's a lot of kids who have not done well at school. They are playing system. And we sort of, as a general rule, if you really had someone who was really struggling, first thing you would say to them, look, go and have an eye check.
Yep.
And the other one was a hearing check.
Yep.
And it was surprising how often they came back and went, oh, I never knew. Yeah. And that started on the difference for them.
So if any child's struggling, definitely, we need to have a check. And I think it's going to, from looking at the Chinese data, we're going to see a lot of primary school kids being picked up as being short-sighted.
Yeah, because the kids are, they're 17, 18 by the time they get to us, and they're discouraged.
Yeah. But one way, if someone's short-sighted, if you say, can you see the blackboard? If they say, no, not clearly, and if they look through a little pinhole, which you can make with your fingers, and if you say, does that make it a whole lot clearer? If they say, hey, yeah, that's great, well, go and get your eyes checked for glasses. Okay.
Tell more about the lenses that find out useful for?
So the orthokeratology lenses. So I personally don't use them. I don't prescribe contact lenses. I'm a researcher, not a routine person now. So these have been around for about 20 years. They're like hard contact lenses, and they're thicker than the ordinary ones. So they're quite uncomfortable, and for that reason a lot of children won't do it, even if mum and dad are there saying, no, you've got to wear them. The worry people had with this was that you may get an infection in your eye from sleeping with the contact lenses. So the soft contact lenses, although there are ones that you can sleep with, we recommend you shouldn't because you increase your risk of infection. So the trials that were done on the hard contact lenses or the ortho-K lenses didn't have any of the few hundred children in that develop any infections, but a national audit in the United States looking at anyone who's used these who's got an infection show it is happening, 1 in 1,000 or something kids roughly. So it is a potentially serious side effect of that that's made people a bit cautious. So the uncomfortableness and this slight risk of infection are the two things why it's not commonly used. The atropine treatment, it is more likely to be used. Of the kids we enrolled in the study, we only had a couple drop out because they didn't like putting a drop in every night.
I find your figures quite interesting on the Line Eye Health Program,
Yep.
so national program. And just recently we've started testing kids in school, early school age kids,
Mhm.
and we're finding about between 1 in 4 and 1 in 5 kids have got some sort of diagnosis for myopia. But we also tested some Year 6 kids last year, and we found the increase was quite significant, almost up to 50% helpful.
Right. So not all of them will need glasses for myopia,
No.
but yes, that's the worry is if we're looking at the entire school population turning up in the eye healthcare system in the next few years, we don't have enough people, we don't have enough optometrists and ophthalmologists to actually see them all. So this is a worry that we have to look into.